Hello, and welcome to today's video where we will examine a case of septal mucositis. The patient that we will be examining and operating upon has had a septal ulcer in place for approximately 17 years. What we're seeing here is cleaning off of some of the surface debris from the underlying ulcer, and what the patient has is actually a layer of mucosa that is actually very unhealthy and will tend to build up crusts. It tends to not have good function in terms of mucociliary clearance, flowing of mucus along its surface, and therefore have crust develop over time. And also the area will tend to be fragile and will tend to ooze blood from the edges, as we're seeing here as we clean the area off. So this patient has tried numerous things to have this healed, multiple different agents. Nothing has worked. So we're now scraping the patient's ulcer in the operating room to remove the surface epithelium. This tissue basically will not allow this area to heal, and therefore if we remove it, we can allow the normal epithelium from the periphery of this ulcer to actually heal in over the ulcer itself and hence normalize the tissue. As the patient has failed for this area to heal with so many topical agents, etc., it was time to resort to a more powerful means to potentially get this healed, which involved scraping, and we'll resurface the area. As we scrape the area, we are actually trying to leave the perichondrium over the cartilage of the patient's septum. This would be the deepest layer that is directly over the cartilage and actually provides it with nutrition and will act as a very nice substrate for the mucosa to grow over this area. So we'd like to leave this tissue if possible, but scrape away all the unhealthy epithelium that is overlying this area. After completing the scraping, we can see that up front there's a very pale area where actually the perichondrium has been unfortunately scraped away. But for the most part, we have a good bed of perichondrium that will allow the mucosa to grow over this area most rapidly. A Doyle splint is inserted into the right nasal cavity prior to placing an Acell graft into this area between the denuded region of septum and the Doyle splint. This material is rich in growth factors and will allow the mucosa to heal from the edges to cover the area. And we see the Doyle splint sutured in position now that is fully overlapping the Acell material, which is lining this denuded area, with a small button on the opposite side to anchor the suture. And here we see a different patient, approximately 3 months after surgery, and for the most part pretty well healed on their left side. The mucosa is white, pale, but actually functional, with very minimal crusting. An improvement. Thank you.